Our vaccine is an oral, thermally stable vaccine capsule. In fact, this is a COVID-19 vaccine. Now, there's a very big difference between how this will be absorbed by your system and a normal injection. When you think about how you catch COVID-19, you catch it through your mucosa, in your nose, your mouth, your throat. It eventually goes into your lungs. It's your mucosal immune system that sees this first. Now, with a capsule, what we're able to do, we're able to administer this orally. So you swallow this. This then goes into your stomach, and this is where our intellectual property comes into its own. We stop it being killed in your stomach. That will then go into your intestines, your gut, and then it will infect cells in your gut and produce a vaccine and produce immunity. Those cells in your gut are the same mucosal cells you have in your nose and your mouth. Therefore, you get mucosal immunity. Now, if we administered this using an injection, you'd get what they call systemic immunity. It's a blood-borne immunity. But this does both. So in that way, it's super important. But I also mentioned its thermal stability. What it also does is it allows it to be sent out in the post. So we talk about vaccinating in Britain here, say 67 million people, in America, 330 million people. You imagine the size of the lines, the places you're going to have to go to get injections. You'll be standing next to other people who've got the disease. You'll be standing next to healthcare professionals who are trying to inject you. With this, you don't. This is as simple as sending out via Amazon, Alibaba, or the mail. It's very straightforward. So it's double immunity, and it's able to be shipped around the world very easily. It's thermally stable.
And when we talk about treatments or potential treatments for COVID-19, the view, my understanding, is that there will be multiple treatments that are used to try to, help those who are already infected. When it comes to vaccines, do you see there being one winner, or will multiple vaccines that are currently in development end up being part of the solution here?
There must be more than one vaccine. All the 21st century vaccines are based around similar technologies. We're all taking the spike protein from COVID-19, and we're using that to trigger your immune system to develop antibodies. Which one will be the best? Well, we think ours is going to be the best by a long way. But I think you need to cover all the bases and try more than one. Also, one of the big problems we're going to have globally is how do you manufacture enough? Now, with our approach, it's as simple as brewing. You put it into a bowl, it's called a bioreactor, and you basically grow it. You then freeze it down. But many of them are using very difficult to obtain antibodies. The production will be very slow. We're hoping to be able to make millions by Christmas.